Your child snores loudly, breathes through the mouth, and keeps getting ear infections. The ENT suggested adenoidectomy. The adenoids are a small pad of immune tissue high behind the nose, above the soft palate. You can't see them through the mouth. Adenoids help fight germs in early childhood. They peak around ages 3 to 7, then shrink naturally by adulthood. When adenoids stay enlarged, they block the nose, disturb sleep, and interfere with ear drainage, causing snoring, mouth breathing, and infections. Doctors consider surgery when symptoms are persistent, affect sleep, hearing, or growth, and haven't improved with sprays, allergy care, or antibiotics. The surgery is done through the open mouth while the child is fully asleep under general anesthesia. No cuts, no visible scars. The surgeon uses a curette, suction cautery, microdebrider, or coblation to remove the tissue. All approaches have similar outcomes. The procedure itself takes about 20 to 30 minutes. Most children go home the same day, a few hours after waking up. Expect a sore throat, mild ear pain, bad breath, and a blocked nose for a few days. Soft foods and cool fluids help. Most children feel substantially better within 3 to 5 days and return to school and normal activity within about a week. Serious complications are uncommon. Small risks include bleeding, infection, temporary nasal-sounding voice, or rarely, some adenoid tissue growing back. A common question: no, removing the adenoids doesn't weaken immunity. The rest of the immune system continues to protect the child. Parents often notice quieter sleep, easier nasal breathing, fewer ear infections, and better mood and concentration in the weeks that follow. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.